Miscarriage. Why it happens and how to deal with it. Recovering from a miscarriage isn't easy. It may be the hardest life event you go through, as an expecting mother or as a couple. With that being said, coming to terms with a miscarriage, both physically and mentally, takes time, support, and patience. Especially if you were rejoicing over and experiencing a healthy pregnancy a few weeks ago. Coping with an unexpected and sudden miscarriage can be difficult on your physical and mental health. You are possibly going through a sea of emotions right now. During this time, it is normal if you feel detached from everything and everyone, including your family and your partner. You may have trouble eating or sleeping at first. You may be depressed or angry and resentful. All your feelings are valid. It can be difficult to plan your next steps at the moment. But keeping your doctor and your partner in the loop about what you are going through is a wise decision. To help you understand your situation a little better, in today's video, we have covered everything you need to know about miscarriages, including causes and how to recover from them. What is a miscarriage? A miscarriage, also known as spontaneous abortion, is characterized by the loss of the fetus or baby before 20 weeks of pregnancy. It generally occurs in the first trimester or the first 3 months of the pregnancy. Miscarriages can happen due to several medical reasons. Most of these reasons aren't even within the mother's control. In fact, as many as 50% of all pregnancies end in miscarriages. That means every 2 in 4 pregnant women have suffered a miscarriage. More than 80% of miscarriages occur during the first trimester or within the first 3 months of pregnancy. Miscarriages are less likely to occur after 20 weeks. And if they do, they are called late miscarriages. As we said, experiencing a miscarriage is usually not within the mother's control. But knowing the risk factors and causes may help you understand the event better and get the support or treatment you need. No matter what happened, always keep in mind that the miscarriage wasn't your fault and nobody here is to be blamed. And you are certainly not alone in this. Miscarriage signs and symptoms. Typically, the signs and symptoms of miscarriage vary depending upon which stage of pregnancy you are in. In some cases, it happens so suddenly that the pregnant person doesn't even realize they are pregnant before they miscarry. However, some of the most common signs and symptoms of miscarriage are severe cramps, discharge of tissue, pinkish white mucus and fluid from your vagina, weakness and fatigue, severe back pain, heavy spotting or vaginal bleeding, fever accompanied by other symptoms, weight loss, contractions, tissue that looks like blood clots and passes from your vagina. If you experience any of these symptoms, consult your doctor immediately. Miscarriage causes. Even though there are certain risk factors associated with miscarriage, usually it is not the result of something the pregnant person may or may not have done. Most miscarriages happen because the fetus fails to develop normally. There are a number of factors that can cause this. Number 1. Genetic or chromosome issues. Miscarriages can occur when the cells of the embryo randomly divide or due to a damaged egg or sperm cell. Issues with the placenta can also lead to miscarriages. Partial molar pregnancy. This occurs when the mother's chromosome remains but the father provides 2 sets of chromosomes. Blighted ovum. In this case, no embryo formation happens at all. Molar pregnancy. In this case, no fetal development occurs at all since both sets of chromosomes come from the father. Intrauterine fetal demise. Here, the embryo forms initially but stops developing before you notice the symptoms of pregnancy loss. Number 2. Lifestyle choices or underlying medical conditions. There are some conditions and lifestyle choices that can interfere with the development of the fetus. Obesity, uncontrolled diabetes, poor diet, alcohol or drug abuse, trauma, infections, high blood pressure, abnormally shaped uterus. Types of miscarriages. There are a few types of miscarriages, and upon analyzing your symptoms, your doctor will be able to diagnose your condition. Number 1. Missed miscarriage. The embryo dies without the pregnant person's knowledge and they don't deliver it. Number 2. Complete miscarriage. In this case, all pregnancy tissues are expelled from the body. Number 3. Incomplete miscarriage. Some tissue or placental remains still remain in the body. Number 4. Threatened miscarriage. Bleeding and severe cramps signal a potential future miscarriage. Number 5. Septic miscarriage. In this case, an infection develops in your uterus. Number 6. Inevitable miscarriage. The presence of bleeding, cramps and cervical dilation point to an inevitable and unpreventable miscarriage. Miscarriage do's and don'ts. Do's. Number 1. As we said, going through or coping with a miscarriage can be a difficult life event. During such a time, let yourself feel the feelings, but don't blame yourself. Number 2. Focus on your relationship with your partner for the time being. Talk about how you can handle this together before devising a future plan to conceive again. Number 3. If you are having trouble coping with the miscarriage, seek professional help. Many grief counselors run support groups where mothers who have suffered a miscarriage get together and help each other get through it. If your relationship with your partner is breaking down, consider couples therapy. Don't. Number 1. Don't blame yourself. Remember that there is nothing you could have done to possibly prevent this miscarriage. Number 2. Don't pretend that the miscarriage didn't happen and jump back in your normal routine quickly. You should allow yourself time to grieve and your body to recover. Number 3. Don't worry about another miscarriage. Remember that experiencing a miscarriage doesn't mean you won't conceive again in the future. Most women who experience miscarriages have healthy pregnancies and healthy babies later in the future. As we said, it is normal to experience a wide range of emotions after miscarriage. This is a vulnerable time, and you should take as much time as you need to grieve your loss. Ask for support when you need it, and don't hesitate from reaching out for help if you feel overwhelmed. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.